And welcome to Lynx's Physician Friday. Today's panel is about bridging the gap between the medical world and the fitness world as it relates to preventative healthcare. This is a topic that we've discussed many times over at Lynx Fitness Club and is something of great importance as it relates to the services that we offer and our overall goal of improving the health outcomes for all the clients that we have in the club. Before we get started, if you guys have any questions that come up during the panel, please type them into the chat box down at the bottom of your screen. We'll get to them hopefully at the end of the panel. I'm the co-founder and general manager of Lynx Fitness Club. We're lucky enough to have Dr. Rich Joseph here with us today. He's the medical director of Brigham and Women's Hospital Center for Community Wellness in Dorchester, and is a practicing clinician for the BWH Center for Weight Management and Wellness. He's also, prior to his medical career, was a certified personal trainer and worked with clients similar to the way that our trainers do. And so he himself has, bridged this gap between the medical field and the fitness field. So he's, just a great person to have on with us today. Also on the panel is Terrence Kozmor, the Director of Fitness for Lynx Fitness Club. He's been training clients for over 15 years. And Brian Cammarata, a personal trainer at Lynx Fitness Club, who's also been training clients for many years. And so I think it'll be a good discussion. What brought this topic out, especially in the environment that we're in today with the COVID-19 outbreak. We're seeing an added importance on having a strong body, a strong mind, a strong immune system in order to fight this disease. And this is a topic we've been interested in for a long time, but it's extra important today. So we thought it'd be great to start the conversation and hopefully get a few of our members and the greater Lynx community interested. We'll go through just the role of the primary care doctor currently and where that role ends, the role of the fitness club and personal trainer and fitness professional, and where that ends and why there's not more of maybe a communication between those two different roles. And then we'll talk about ways that maybe we can solve that problem, what maybe is an ideal scenario out there and how we can fix it going forward. So, just first off, Dr. Joseph, if you don't mind, just talking a little bit about yourself, how you got interested in the topic, and then maybe talk a little bit about the role of a primary care doctor in preventative health and where that role starts and ends.
For sure. No, thanks, Bill, and thanks all you guys for having me here today. Really appreciate it. It's great to be with you, and for those who tuned in, great to meet all of you. As Bill mentioned, I am sort of first and foremost a personal trainer, and was ever since high school, basically, and before I got into medicine and went through that career path. And so something that's near and dear to my heart, and fitness and exercise, I still believe is like the best medicine out there, for sure. And trying to figure out how to get that to more people. I trained here at the Brigham in internal medicine and primary care. And through that experience, definitely saw the value and importance of a primary care doctor as a trusted ally and relationship in the healthcare system. And speaking as a pretty young male, like I don't see my primary care doctor that often, but I certainly recognize the value of having that relationship. And I worry about the younger generation of people who may not sort of see the value of primary care and understand why it's important for them. And so I think that the challenge is that a lot of primary care doctors these days tend to take care of an older demographic of people who tend to be more ill and on multiple medicines and have to see a variety of specialists sort of within the healthcare system. And I think younger people, speaking for myself and probably some of you, don't particularly want to feel medicalized, and going to a primary care office is not the most appealing place to go. But it's really important, particularly in terms of thinking about prevention, right? Like long term, I mean, it's what we do today. It's, your participation at Lynx and the other things that you do for your health behaviors that are going to really drive your health outcomes in the long term. And, I think primary care is instrumental in that, in the sense that they have diagnostic tests and risk risk screenings and harm reduction, that they basically like, that's sort of the focus, is really to keep people healthy, especially at a younger age. And all of us have predispositions to different things. And, you know, often I would diagnose people with high blood pressure who may be active and didn't know that they had it, or with prediabetes and things like that. And so I think, you know, that is what I see as the true value of primary care, and then being able to help sort of guide you if needed to specialists within the healthcare system, and sort of understand in that process.
Billy, you're on mute.
That's going to happen. Everybody's been, you know, to the primary care doctor before. They know what that process is like. And, you know, generally if you're healthy, you know, you're checking some boxes, you're taking some tests, and just checking up. Or if you're not healthy, then maybe you're being prescribed medication, or to see a specialist, or to do some sort of surgery. But why, if you don't mind, just maybe explain the role again, just briefly, the role of the primary care doctor, and then where it ends and where you wish maybe what maybe in terms of a gap, and where you wish it might go, and talk a little bit, you know, getting into what the personal trainers and your just general thereafter.
Yeah, of course. I mean, I think this is a good discussion. My role right now, as Bill mentioned, is I actually do weight management and obesity medicine at the Brigham, and that's, I look at it as a sort of a focused version of primary care. I deal with people who are, you know, overweight and obese, and certainly in medicine we have a variety of tools to help those people, whether it's medications, which is a lot of what I do, is prescribing meds to help people with weight management, and then everything to bariatric surgery. But I do tell people, and obviously my background sort of enforces this, like it is the data that these people do that are going to totally dictate sort of how well they do in terms of managing their health and their weight going forward. And I think one of the challenges for me, in given my prior life as a fitness professional, is that so many of these people really have the desire to be more active, want to be more active, don't know how to be more active, and particularly the importance of resistance training and as a way to sort of increase people's metabolism and get them to lose weight is so critical. And I think one of the challenges that I face every day is people asking me, well, where do I go to do this? Who do I work with to do this? Do you have any recommendations of people who I can go, you know, see to do this? And unfortunately right now, and I think that's, you know, a lot of the reason we're having this discussion, is there's no clear mechanism for me to sort of refer people in to a, you know, best-in-class personal trainer. And that's what a lot of these people would benefit from, honestly. In addition to the work that they do with me, they would certainly benefit from that.
Yeah, and Terry, you've been, you're on mute as well, by the way, so just in case. You've been a personal trainer for 15 years. You obviously are an expert in the role. Why don't you just describe kind of where a personal trainer's job starts with a client from the assessment onward, and what your role is in terms of, you know, providing preventative healthcare for a client.
Sure. You know, thank you very much, Bill. I hope everyone's having a great day so far. It's beautiful outside, so hopefully after this call we can get out. But really the most important thing, not only with my role, but all my coaches, first and foremost, like you're saying, is with the assessment process. That's us onboarding our clients, figuring out what's going to be the best for them long term. Ultimately, we're trying to get them to live a very active and you know, long, healthy lifestyle. In order to do that is really addressing their immediate needs. That might be weight loss, you know, gaining strength, mobility, lack of mobility, and then based on all of the assessments that we do, whether it be an in-body scan, functional movement screening, really trying to figure out a way to get that person also based on their personality in line with one of our coaches. So we at Lynx, you know, we have an unbelievable crew, unbelievable, you know, amount of coaches that we have. So yeah, so really it starts with the onboarding process, you know, figuring out through the assessments what they really need. Is it, you know, nutritional coaching? Is it mobility? Is it strength? Putting all those components together and then really aligning them with the best coach. So, yeah.
And then the coach's job, once they go through that assessment, is really to set them up with a short-term, medium-term, kind of long-term plan based on, what, I guess what their strength, mobility, what their flexibility, et cetera, is. And what kind of, I mean, it's kind of a rhetorical question, but like what kind of, feedback do you get from their doctor, for instance, primary care doctor, or really any of the specialists that they see? I know sometimes you talk with physical therapists and things like that. Do you really have any connection with the rest of their healthcare world?
Not too much. I mean, when you're doing the Part Q and the original, questionnaire and going through kind of all their medical history, you're trying to pretty much, build a picture of kind of where they started, what were kind of maybe some of their injuries or setbacks or medical conditions throughout their life. And we're asking them questions, are you on maybe beta blockers or, some other heart medication, or, basically just getting a whole scope of where they're currently at. Of course, we're asking questions like, when's the last time you've been to maybe your primary care physician, your internalist, whatever it really is. If they're coming to us because they've come off an injury, of course, we're trying to have communications maybe with their PT or their athletic trainer. But for the most part, there's been a huge disconnect for a long period of time. So I think that, us having this conversation, it's really good because hopefully we can really bridge the gap between, primary care and kind of what we do. But there's a lot that really goes in behind the scenes, really when we meet with a client and we're in that session, and how that session starts, whether it may be, breathing or mobility, and then we get into their movement prep and then the body of that session. And then maybe there's some type of metabolic conditioning or a finisher. Also on the back end is really creating that structure of that program. So that starts with, that original assessment and then that diagnostic test and really just seeing how they move as an individual. And then from there, we build out their program. We do that in mesocycles. So we do that, in month stints. And then every month we're reassessing the client based on kind of where their goals are. For everyone, it's different. For some clients, it's just to move better. For other clients, it's to lose weight. Other clients, they really have specific, maybe sport-oriented goals. So it's really different. And that's really the difference. I think that what we do at Lynx and some of our coaches, we just do a really good job of listening to our members and our clients, and then building a really good holistic program around that, with some nutritional foundations and then definitely exercise as well. So.
And Dr. Joseph, you mentioned, people not having an understanding of what to do in order to be active. What are the best ways that they can be active? If you don't mind, what do you see as the role of kind of a personal trainer, even the role of a fitness facility in people's health and well-being? What kind of medical issues can be prevented just through having an active, routine and eating healthy? If you don't mind talking about that a bit.
Yeah, of course. I mean, I think that in the world we live in now, medicine really was born out of a period of where, communicable infectious disease was really rampant, right? Obviously right now we're in the sort of the midst of infectious disease and sort of seeing how scary that can be. But for large part, I mean, for the past few decades, communicable diseases have been on the downslope, and it's really been lifestyle related diseases that otherwise could be prevented that end up becoming chronic diseases that are really sort of burdening everyone, both physically and fiscally, I think, in this country. And so it include, diabetes, blood pressure, and the things that result from that, like, heart disease, stroke, issues like that, and then depression, anxiety, are other big ones as well. And I think it's this top 7 of the 10 sort of global killers in this world are all lifestyle related diseases that otherwise could be prevented with the right plan and strategy. Unfortunately, we don't have a healthcare system that is oriented that way yet, although that is changing over time. But I definitely see health for most people starting where you guys are, honestly, at a place like Lynx, not where I am, honestly. And as I exercise is the best for everyone, and it really helps with pretty much all those things that I just listed, right? And then also musculoskeletal issues is another big sort of cause of complaints that people come in to see the doctor for as well. And so I think, I think it's giving people proper movement patterns is super important from like a musculoskeletal standpoint. Doing things like resistance training and cardio is super important for people's metabolic health. So thinking about things like diabetes, high blood pressure, all that going on. Super important for prevention of those things and management of those things. Honestly, those conditions like diabetes can be reversed with the proper lifestyle. So that's really powerful. And then I also think it's the community aspect of a fitness facility that's also really important for people, is to do this in, a group-based setting. People see each other, they feel, relationally connected to each other. And there's something about fitness where people really connect with each other on a very like sort of human, raw level, which is a very powerful thing, I think, for people in an age where we've become quite disconnected in many ways with our technology and the other ways that we communicate. And so there's something very human at its core about fitness, I think, which I think is also important for people's health.
And you mentioned a little bit about kind of the origin of modern medicine and that. What do you think is keeping there from being a better connection between the everyday fitness constructs for a person and their actual healthcare system? Why is there no connection? Why are you not, as a doctor talking to Terry on a, regular basis about 5 of the clients that you have? Obviously there are timing constraints and insurance. And so can you just talk a little bit about that?
Yeah. So I think on a few of them. So one is like time is definitely a big one, right? I was just telling these guys before I got on that, I'm doing virtual clinic right now. And I saw, I think, 8 or 9 patients in the span of 4 hours the other day, and 5 of those were new patients. And so it's a lot, and there's a lot to get through with each person. And so time is definitely a big factor. And time is a reflection of the billing process in medicine and how we're reimbursed. And unfortunately now that a large part of the care system does not reimburse for prevention and instead reimburse based on treatment, right? You diagnose someone with an illness or a disease, right? And unfortunately label them with something, and then that's the way that you get reimbursed. And only really in sort of capitated systems like Kaiser Permanente or others is that changing, where large health insurers are bearing the risk for a large population of people, and then obviously there's an incentive to keep people healthy from a young age. I think the challenge now is that with insurance, young people tend to churn off of they go on one insurance plan, then another insurance plan, another one. And so insurance right now doesn't have the incentive right now to really think about how do we keep this person healthy for the long term, and therefore is not reimbursing for the services that Terry and Brian are providing, unfortunately, even though I would argue that they should. And so that's a long-term play to try to figure out how to make that happen. But I think that just having this discussion and educating some of the people who are on the phone about why this is important, right? I think ultimately it's also the consumers, the clients or patients or whatever you want to call yourselves that are going to vote with their feet eventually over time too, and recognize like this is critical for my health, what I'm doing here at Lynx and my other sort of health and wellness part of my life. And that should be better integrated into my healthcare.
And do you know of any like places out there or countries or, that maybe are on a better path to resolving this issue, that think of healthcare in more of a preventative way than just resolving the issue once it happens with a patient?
Yeah, I think that, I think it might be a little easier for certain countries that are culturally a little bit more, probably smaller, and then also culturally more congealed or aligned to create a healthcare system that's more based on prevention. I mean, I think that part of it's a reflection of our society at large, and we put a lot of value on sort of individual responsibility and behavior in this country, and so don't necessarily think as much about like the collective totality of everyone, even though all of our health influences everyone else's health, ultimately. And so and then I also think it's interesting to think about countries like Scandinavian countries that spend just as much as we do on collective both healthcare and social services, right? But they're the way that they proportion those things is totally different. So they spend much more money on social services like childcare, early child education, making sure that their built environment is promoting healthy activity, versus us. We spend the majority of our dollars on healthcare, treatment-based healthcare. And so I think that's important to think about as well. And then I also think it's interesting to think about certain countries that have these areas called blue zones. I don't know if people have read the book called The Blue Zones. It's a really interesting book about, I think it's like 5 or 6 different hotspots in the world where the average life expectancy is about like over 100 years old. And sort of why is that, right? And a lot of these cultures tend to be, have certain themes that run throughout each of these cultures. So it's people who are very socially connected, high level of purpose in their life. They're physically active, not because necessarily they're going to the gym every day, but their work necessitates them being active. That's a big one. And then their dietary pattern is also a huge influence as well. And so I think it's interesting to think about some of these others. I think these examples can give us some insight and hopefully a bit of a prescription to think about how we can create more of a blue zone here in the US over time, or at least locally to start.
Yeah, and we talked a little bit about insurance and just the way that the system is set up in the US, which obviously very difficult to change, and healthcare right now is a issue politically. But what are some ways that we can resolve this problem given the contracts that we're working within right now? You've talked with me at length about the concept of a performance physician, and a network of practitioners and passing information along from one practitioner to the next. If you don't mind just chatting with everyone a little bit about that.
Yes, I mean, that's really born out of my background as a trainer, right? And recognizing that it's really what happens in the fitness facility or the grocery store and stuff like that really dictates people's health going forward, more so than what I do, right? I see people on a quarterly basis if I can, but I feel like, especially when we're talking about in-depth behavior change with people, which is really the holy grail of healthcare these days, is behavior change. Like, you need to see people on a much more regular basis and be working with a group of practitioners that are also seeing that person on a much more regular basis, right? And so most people are going to go to their gym, to Lynx, more often than they're going to come to their doctor's office. And so from my mind, it makes a lot more sense if I was interacting with the folks who are sort of composing their specialist network of their health and wellness needs. This is particularly true, I think, obviously for younger, generally healthy people who are thinking about prevention, performance in their day-to-day lives, avoiding sort of health issues in the future, and have that mentality already, but need it to be streamlined and to be tailored to their own unique physiology and psychology and their own needs and limitations. And right now, there's not much that looks like that. And I think, to your point earlier, one of the things I want to mention was that we're just not trained that way in medicine to think that way, right? I'll look back to my medical education. I got maybe a few hours of nutrition education, if that, no exercise education. I mean, I'm grateful that I have the background that I do, but most of my colleagues don't, right? And so I think it's going to take, maybe some people like me who think differently and people like you guys who think differently and want to connect these systems in a more creative way for people. And then also people who buy into that and recognize that this is really important and want to spread the word about it, right? So it may not be insurance who changes first, but I think that if this can start on a more local level initially, then it could definitely take off.
Yeah, I think it's really interesting that most people don't understand. You think of a doctor, and you're obviously very well versed in pretty much every topic that exists medically, but you may not get a lot of nutrition experience, and a fitness club with a nutritionist, for instance, provides an amazing service that will help people and prevent them from getting sick in the future. People don't really necessarily understand what skills that a person like Terry or Brian have that a doctor doesn't, and that kind of build upon the skill set that the doctor has. So, having this connection between, the doctor who is able to diagnose someone or at least point people in the right direction of what they need to do to be healthy, able to point them to someone like Terry or Brian who can, on maybe not a day-to-day basis, but on a more regular basis, see that person and help them improve their outcomes. Brian, we've talked a lot about resistance training and the importance of it. And it's funny, I'm a fitness club, a co-owner of a fitness club. And up until probably I started Lynx, I wasn't really a big resistance training guy. I used to run outside a lot, and that was the majority of my exercise. So I'm now a big believer. It's one of the reasons why I wanted to have this panel here, and I'm very interested in this connection between health, long-term health and fitness. But why don't you talk a little bit about resistance training, the importance of it, and how you have helped your clients see kind of results and improve their general health?
Sure. I think, the most important thing for me, and you've seen this, you're a great example of this, is how do we make exercise a part of your life? That goes back to behavior change, because of all the things we do with clients, the most important thing is creating habits where they're doing exercise daily. And for me, exercise daily hopefully means movement as far as activity, but resistance training as far as other modalities is number one. Just because it offers so much benefit in terms of increasing your metabolism, building muscle, getting stronger, being able to move correctly. I mean, I think that's the biggest thing Terry and I probably do with our clients is, we're really movement coaches. We're teaching you how to move. We're trying to improve areas where you're having pain or weakness. But strength training really offers different benefits than, say, cardiovascular training or yoga or any of those other modalities, just because it's really like investing upon itself in terms of building muscle, because the more muscle you can have, the more it increases your metabolism, the more you can eat. I tell clients this all the time. The holy grail is you can eat more, look better, and move better. And that's really what we're trying to do. I don't want people to have to starve themselves to lose weight. I want people to eating more with a faster metabolism, have more muscle, look better, and move better. And that's really what resistance training offers. It does, there's going out and running on a treadmill is great. It's great for your heart. It improves your cardiovascular fitness. It's not going to build muscle. It's not going to strengthen your bones. And it's not going to do some of the things that resistance training does. So for me, I'd like to see more of an emphasis from the medical community. And obviously Dr. Joseph emphasizes this because he has a background in it. I'd like to see doctors say, if you're not resistance training and you're having some of these underlying medical issues, you should be. And if you can't do it on your own, which you probably shouldn't if you haven't done it before, you should go work with a trainer. And, I think the future is that it starts to get prescribed much in the way that physical therapy does. And maybe insurance covers it at some point. But I think the easiest way now is just to start the conversation from the doctor saying resistance training is something you should be doing 3 to 4 times a week. Walking's great. Running's great. Resistance training should be number one. Obviously, I'm biased.
Yeah, no, that makes sense. And some of the things, Rich, that we've talked about, some of the challenges, right? As a doctor, if you wanted to, quote unquote, as Brian explained, prescribe personal or just fitness in general, some of the challenges out there. There's not a great network of practitioners that you necessarily feel comfortable with in order to prescribe that. Obviously, that's part of the reason that we started our conversation together, was because you saw some of the things that we were doing at Lynx and considered that to be on the cutting edge of fitness. A formal process for passing information from you as the doctor to a day-to-day, fitness practitioner like Brian or Terry, and then their ability to maybe pass information back up to you as the doctor. That's something that currently doesn't exist in the current construct that we have. One thing that we've talked about quite a bit is just the co-location of services. So the ability to have maybe a doctor's office, primary care office, or even just office hours in a place like Lynx Fitness Club. If you don't mind just chatting with a little bit about that and why you think it could be helpful or would be important. Obviously there are space constraints and other things, but why you think that would be a beneficial thing to have long-term within our society.
Yeah, for sure. And so just a response to a few things. So I agree. So right now, especially in weight management clinic, right, the emphasis is obviously these people want to lose weight. And I tell them that actually probably one of the best things they could do is do resistance training to help them lose weight, to increase their metabolism. Because so many people, if they've been going on these diets for so long and doing the yo-yo dieting phenomenon, like their metabolism is just totally like at like ground level. And so really resistance is huge for them. And I think one of the biggest challenges, to your point, is I don't have like an immediate referral network. Right. Like now I know, like, you know, Terry and Brian are great at this. And so I would feel very comfortable referring patients to them. But right now, like, that's sort of the limitation. And I think, you know, I think all of us would agree that one of the challenges in the health and fitness space right now is that it's hard to standardize like who's good at what they do, right? There's a lot of different certifications out there, credentials, Instagram, like whatever it is that like validates people these days. And so I think that is one of the barriers between sort of how do we get physicians to say, this is what you should do, I'm going to refer you to this person, right? How do you build that network and that trust is a challenge. So that, I mean, that sort of leads into this discussion of, wouldn't it be cool if someone like myself spent some time at a place like Lynx? I think that, because then I'd have much more, you know, direct engagement, obviously, with the trainers, and I would be able to sort of think about the larger health picture for people. And I think one of the challenges with, I mean, I'm speaking for myself, but I'm sure this resonates with others, is like the doctor's office is not particularly the most motivating place to come to think about your health. And most people associate doctors with disease, and I don't think that necessarily should be the case. I think doctors ideally are thinking about promoting health, right? Not just treating disease. And so, but I think the setting in which you do that has a big impact on people and how they behave and how their behavior changes over time. And so, you know, I think I don't need to be doing a bunch of blood work on people all the time, but it would be great if I saw them on a much more regular basis, even if it was just, you know, I just saw them at the club, right? And just checked in how they're doing, understand what's going on with their trainer, understand if they're doing dietary work or seeing a dietitian, and can really, you know, I think one of the benefits of what I do is I really get to know people's psychology really well and understand their physiology and their limitations. And so how do we, you know, there's no one plan that works for everyone, right? Behavior change starts very differently for all different people. I do think fitness is a great place for people to start with their behavior change, though, because you do see, you know, pretty immediate results for people. It's very proactive, right? Rather than thinking about like a diet, which sounds like restrictive and not particularly motivating for people. And so fitness is something that is proactive, it's community building, you feel good after you do it, pretty immediate results for people in terms of their mood and their energy. And so I just find it a much more uplifting place and setting to think about your health. And I think that the emphasis on performance, right, rather than like your blood pressure or your sugar level or something like that, it's more your performance of, you know, how are you doing in the gym? Like, what are you doing day to day? Like, are you making progress towards your fitness? And then over time, if you are, like, your health will take care of itself, honestly. Like, your health should be a byproduct of what you're doing day to day to perform at your highest level.
Hey, Bill, can I just jump in on the nutrition part? Because I thought this was really important. And, you know, Dr. Joseph has a background in training and a background in nutrition. So he's overly more qualified than most doctors in his position to talk about nutrition with their clients. But there's some data about, you know, only 30% of U.S. medical schools offer their med students the recommended allotment of nutritional training. So if you're a client or a patient and you go to your doctor and 70% of the doctors don't have any sort of nutritional background and they don't really have great answers for you, if you can't go to your doctor for nutritional advice, where do you go? And where do great minds go for the answers nowadays? They go to Instagram, okay? And they go to these places where they get really simple solutions. They might not be the best solutions, but this is where keto and this is where the carnivore diet, this is where these things come from, is because people want simple answers. It's meat or no meat. It's carbs or no carbs. Nutrition is really complicated and it can be really nuanced. People don't have a person to have the nuanced conversation with, so they try to get a simple answer. And a lot of times that's where you see these fad diets come from. They come from simplicity. So it'd be great if that doctor doesn't have that, you know, nutritional background, can they recommend them to a gym like Lynx where we have a nutritionist on staff? Or if there's someone like Dr. Joseph at Lynx who can talk to them about nutrition in a more nuanced way, because otherwise they go to Instagram and they're getting really simple information that's usually pretty flawed.
Yeah, no, that's a great point, Brian. And again, any questions that you guys have out there, feel free to type them into the chat box. Just to bring this kind of full circle back to what we're doing at Lynx, what we would love to do in the future, but really what we're doing at Lynx, obviously everybody has various, financial constraints, time constraints, et cetera, that keep them from doing the optimal level of physical fitness, or even on the nutrition side, keep them from eating healthy if they don't have so much time to go to the grocery store and those kinds of things. But we have services at Lynx for a reason, in order to help people to get onto the right path. Obviously, we've talked a lot about personal training, but Nicole Paralisi, our nutritionist, obviously doing some nutrition consulting, even if it's just to get people on the right path. Group fitness classes. I mean, there's a lot to be said about just having the right people teaching those classes, people that are not necessarily focused on just how many burpees can you do in a 30-minute period. They're focused on getting you healthy or getting you fit in the right way, warming you up correctly, cooling you down correctly. And again, we spend a lot of time and effort making sure that that the classes that we offer, as well as the personal trainers that are in the club, are on the cutting edge from that standpoint. And then, just lower cost options. I mean, I came into to really owning a fitness club, but really starting to work out regularly without knowing what to do from a strength training or resistance standpoint. Thankfully, I work with a great trainer, Steve Foster, but I'm also doing some programming where I'm getting I'm getting programs sent to me on a mobile device. It's a lot less expensive on a monthly basis, and helps me to know what to do in between those training sessions in order to improve myself. And it's a service that we offer as well. So, from all ends of the spectrum, on a financial standpoint, we have a lot of different services that we offer. One thing that, again, we'd love to explore in the future, and have been with Dr. Joseph, is how can we bring this medical component, at least in a testing phase, into the club, and help combine the personal training and the healthcare piece together. And it's something that we're going to explore certainly in the future, and we'll be reaching out to you folks to see if there's any interest in maybe beta testing that program. So again, any questions, go ahead, put in the chat box. Otherwise, I definitely appreciate, Rich, you for joining us. Terry, Brian, thanks for joining us, and you folks, thanks for joining us as well. It's a conversation that we're going to hopefully continue on an ongoing basis. Rich, do you have anything else that you wanted to add before we sign off?
I think it's great. I mean, I think if anyone, I would just love to. This is obviously like a passion of mine and a thesis in many ways. And if there are others on the line who have comments or reactions to what we're talking about, and think that we're crazy, or think that, like, yeah, this makes a lot of sense, it would be really helpful to know, to get your thoughts on it. Because I think right now, my sense from like the health and fitness or health and wellness industry is that, people put a lot of time and money into that world, which I think is a good thing overall. I think one of the challenges right now is just that it's a bit fragmented, and the standards aren't sort of up to par, I think, as much as they should be. And so therefore, unfortunately, it's still on the individual in many ways, or the consumer, to really try to put together sort of a holistic health plan for themselves in a way that makes, oftentimes I think people are throwing darts at the wall and trying to see what sticks. And so, hopefully over time we can get to a point where it's more curated, it's more tailored, it's more individualized for each person, sort of lead them through a longer term journey sort of their health and fitness and performance. And that's where we're trying to get. So that hopefully one day you don't have to come to the Brigham. We'll have to put the Brigham out of business overall. I think that's what like the mission. That's what the mission of healthcare should be, right? So we shouldn't have to have all these hospitals, truly. And I'm not saying that I love the Brigham; it's a great place, but ultimately, it's what you guys do at Lynx, and that's going to make the difference for people long term. So it's a pleasure to be here and chat with you guys.
Awesome. If anybody wants to pop on, otherwise, Brian, Terry, any last thoughts?
No, I don't. I think just piggybacking on what the doctor said is, we're trying to keep people out of the hospital. I think the preventative care of a gym and the community it provides ultimately is designed to take stress off the medical system so that, less people are sick. And when you're in the healthcare system, you're not treating as many sick people. You're trying to keep those healthy people as healthy as possible for as long as possible. And that's really the role of the gym in my mind, and the role of the trainer is to help people help people get through that process. So any ways we can make it better, happy to try it out.
Awesome. Well, thanks everybody for joining. Hopefully you understand this is the goal of Lynx. Our goal is to make you guys healthier, make ourselves healthier, and move the gym in the right direction. And hopefully you enjoyed this talk. Rich, thank you so much for your time. Look forward to working with you in the future. Terry, Brian, thanks again. And thanks everybody for joining.